Hello, my name is David Villar, professor of pharmacology at the Colombian Veterinary School. And I would like to start by asking you whether you think that systemic antimicrobials are really necessary to treat superficial skin infections. Antimicrobials are probably those drugs which by no means have been used in a very selective manner for situations in which they are clearly needed. I will probably not be the one denying that I have prescribed them just in case an infection was present. But really, the problem goes much farther in that probably many veterinarians have been using them, if not as placebos, at least as innocuous medications, or maybe because of pressure by owners to satisfy their expectations and somehow keep the business running without a real rationale for using them. So I hope this presentation will help to realize some of the problems that may come from using antimicrobials not very wisely. They are truly a valuable medical resource that we should consider as a real treasure in our medical cabinets. And before we get into the specifics of therapy for pyoderma, I would like to point out that in 2015, AVMA put together a task force on antimicrobial stewardship in companion animal practice to provide guidance on the use of antimicrobials in light of the emerging impact of multi-resistant organisms, which are appearing, and I will show on this presentation for skin disease. But as you can see, they develop some general do's and don'ts on antimicrobial prescribing. And here they show what are the most typical conditions for which systemic antimicrobials are prescribed in practice. And in the case of skin conditions, we're going to see that topical therapy is definitely a better alternative in most cases to using a systemic treatment. I will address in future videos the other conditions like respiratory, urinary tract, or GI disease. But many of the points that they raise here that we use or we tend to use antimicrobials, and they're not always the answer to many of the problems for which we tend to use them. So it's actually time to think out of the box, so to speak, and wise up a little bit on this issue. And the same story could be said for cats, maybe with some slight peculiarities that they also highlight on this other slide. So anyway, if we go back to the canine superficial bacterial folliculitis, which is the same as superficial pyoderma, this is definitely one of those diseases for which more systemic antimicrobials have been traditionally prescribed in dogs, which was put together by the working group of the International Society for Companion Animal on Infectious Diseases. And the other problem that they identified was that there is increased concerns regarding the widespread use of resistant bacteria infecting dogs and cats. And this is particularly so with this methicillin-resistant Staphylococcus. And the fact that some of these superbugs are not responding to some of the major groups of antimicrobials is really a strong stimulus to use a topical approach, as we will see in a little bit. So we're going to see some studies in which the general use of antimicrobials is actually a risk factor for the use of emergence of methicillin-resistant Staphylococcus pseudintermedius. And in fact, there is a strong, compelling evidence that using antimicrobials will actually increase the carriage of these resistant opportunists in dogs, just as it has been also found in people. So if we look at this large epidemiological study that we have on this slide, here they wanted to find what were the most common prescribing practice by primary care veterinary practitioners in dogs diagnosed with bacterial pyoderma. And out of 683 dogs, as you can see, 64% were actually prescribed with systemic antimicrobials with no topical medication. 27% got both systemic and topical medication, and 4.7 got topical without systemic medication. And if we look at which type of antimicrobials were given systemically, the combination of amoxicillin and clavulanic acid was the most frequently used one. This was followed by cephalexin. Both of these two are, as you probably know, broad spectrum beta-lactams. And then the third one was clindamycin. These are definitely first choices for treatment of superficial pyoderma in dogs. The other thing that was also found on this survey is that bacterial cultures and sensitivity testings were done only in 2% of all these study cases. And as we will see in a minute, the recommendations are going to be that they should definitely move away from using systemic antimicrobials, and there are definitely better alternatives. If we're going to give systemic antimicrobials based on susceptibility testing instead of just empirical treatments. So anyway, before we say anything about the recommended therapy, we should say that making a diagnosis is definitely the first thing that we need to do. And this is should always be based on typical lesions that are shown here, and that ideally you want to back up with some cytology to strengthen your diagnosis, and may also tell you if there are any other co-infections with maybe yeast, dermatophytes, mange. Usually the presence of inflammatory cells with intracellular cocci is usually a definitive diagnosis, but usually the absence does not rule out that there might be a bacterial infection. As you can see here, papules, which are those reddish or pink small bumps that you may see in many rashes. Those are kind of characteristic lesions, and usually the presence of pustules, which is kind of the medical terms for those classical pimples filled with yellowish liquid pus. That's usually is kind of the classical hallmark of the lesions for pyoderma. Those pustules are usually made up of white blood cells, which are sent by the body to fight the infection. And those pustules sometimes they rupture and they leave those round lesions with a rim of a scale or a peeling edge that gives the name of epidermal collarettes, which are also kind of a footprint of pyoderma. Once we have made up a diagnosis, obviously the recommendations for treatment of pyoderma, as I say, are basically different from the traditional reliance on systemic antimicrobials, particularly empirically. And this is so in the face of more resistant Staphylococcus pseudintermedius. So guess what? Definitely yes. You and the owner are gonna have to roll up your sleeves, and because there is gonna be a strong emphasis on tropical therapy, and it has been widely underused. And on this table, they basically summarize all the antiseptic agents for extensive or generalized disease that may be used as shampoos, sprays, rinses, lotions, conditioners, and they also include those that come in gels, creams, ointments, lotions, wipes, in case there is a more localized infection. And as you can see, they have all the major active ingredients, which typically include chlorhexidine, benzoyl peroxide, fusidic acid, mupirocin, and they usually suggest using them for 7 days beyond the resolution of all the lesions. And also, usually they suggest to obviously keep the hair coat as short as possible to assist the good contact with the chemical with the skin surface. So anyway, now that the panel suggested to do this topical treatment first, how about choosing an antimicrobial systemically if they decide to go that route? Well, here they have this other table, and as I say, there is really no comprehensive guidelines to base the decision. So they came up with these tier groups, as you can see on this table. And the first choice is usually based on systemic peer review. And it was found that sevofensin, which is a cephalosporin, had excellent efficacy. However, this is a critically important antimicrobial. According to WHO, it's a third generation cephalosporin, so it should probably not be one that we should probably select first. As you can see, most cephalosporins are actually included as a first or second tier antimicrobial. There was no consensus in which group to include them. The other two first choices for empirical treatment on superficial pyoderma are amoxicillin and clavulanic acid and clindamycin or lincomycin. And when culture and susceptibility testing is available, or the first tier drugs are not available for you to consider, then they go into the second tier drugs that are, as you can see, include these fluoroquinolones, aminoglycosides, doxycycline, chloramphenicol, rifampicin, and finally they have the third tier drugs that are usually discouraged because those are usually reserved for treatment of methicillin-resistant Staphylococcus aureus infections in humans. So you may ask yourself, well, how common is it to encounter these methicillin-resistant Staphylococcus pseudintermedius in dogs? Well, it depends a lot on the history of that animal. So if we look at this case control study, they had a population of dogs that had a skin infection with Staphylococcus pseudintermedius. They could identify them in either methicillin resistant or susceptible. The cases were the resistant ones, and they were matched by hospital and time with two control susceptible individual dogs. And as you can see, the results were that the dogs with resistant Staphylococcus were 8.5 more times more likely to have received antimicrobials 30 days prior to being hospitalized compared with the animals that were susceptible. So the next question that could be posed is or that comes to mind is how to treat those methicillin-resistant Staphylococcus pseudointermedius. Well, if we look at these other studies by these two authors, the treatment of resistant Staphylococcus basically follows the same principles as those of susceptible skin ones. They basically suggest combining systemic with topical therapy on this case. And for systemic antimicrobials, you can see that they stay away from the beta-lactams, and they actually include the most common ones that we looked on the second tier drugs that we mentioned earlier. They basically suggest chloramphenicol at the highest dose range of 50 milligrams per kilogram 3 times a day in dogs. They also suggest rifampicin, amikacin, minocycline, clindamycin. And with regards to topical therapy, ideally you probably want to clip the hair coat first, and if you can use a medicated shampoo for 10 minutes contact time, that's probably the way to go. Doing that twice a day or at least 3 times a week. They say that chlorhexidine is probably one of the ideal antiseptics that you might want to use. And some other options that they include here are benzoyl peroxide or ethyl lactate, as I say, at least 3 times a day. So as a summary of everything that we just say, the first thing would be to ask ourselves if we're confronting just the pyoderma or there are some underlying conditions. Make sure that you rule out any other things that might be happening, like allergies, hyperthyroidism, mange, dermatophytes. Could we perform culture and susceptibility testing before we start treatment? And even if we do so, start doing the treatment, but go ahead and do a culture and see what type of bacteria and sensitivity you have. Can we perform a treatment topically only? That's probably going to result in a faster and probably a better resolution of the problem than going systemically. Remember that most superficial pyodermas in general are going to respond more rapidly to topical therapy, but the therapy must be done correctly, and if it needs to be generalized, ideally with a medicated shampoo, you probably want to clip the hair of the animal where it's necessary. And because nowadays many dogs have received antimicrobials, they may carry a methicillin-resistant Staphylococcus pseudintermedius. And in that case, if you decide to treat with a systemic antimicrobial, you may want to do so based on a susceptibility testing. And if you don't have the option to do that, you may want to try the second tier drugs like chloramphenicol or any of the other ones that we mentioned earlier. And finally, remember the panel's recommendation. We should probably reserve systemic antimicrobials for situations in which other more appropriate and alternatives are not available. In this case, topical therapy is the way to go. And if this is not enough to clear the infection on its own, or it may not be correctly applied for whatever reason, in that case, yes, you just definitely want to jump into systemic antimicrobials. So having said this, I hope all this information was valuable to you. So I look forward to see you on future videos. So goodbye for now.